big difference. So now let's talk about where we're going in the future. The forecast model, I think there's going to be pretty substantial growth everywhere. And a lot of the regions are about 15%. So what that means is between 2023 and 2030, we're talking about 15% more RNs per capita in the area. That's like 2% growth a year. That's pretty high. And then into these areas on the right, the mountain states have double that. They're going to have double that growth, a lot of growth. The East South Central, the East West Central, that's not the right name. The Arkansas, Louisiana, Oklahoma, Texas have even faster growth than the other areas. Okay, so that's quite a lot. How does that growth compare to what we've seen over the last 2 decades? It's higher. I'm comparing in an apples to apples way the same projections I just showed you, which are in the blue bars. That's the growth expected until 2030, compared to 2014 to 2023, 2000 to 2014. And they're all like on an equal playing field with the numbers. So everywhere is going to have faster growth than they have been used to seeing, just about everywhere. So that's kind of the key thing to know. James asked, how does that supply growth compare to demand? And I was like, demand is a really, really squishy, hard to measure concept. I pulled the data from HRSA to see what they think about demand. That's the Health Resources and Services Agency. They do these projections. I don't really believe the demand. What they kind of do is look at population growth and assume that we're going to be using nurses in the same exact way, which is just, that's not true. But take that for what it may. The supply growth looks greater than the demand, but again, I don't put a lot of weight on that. I think that we continue to need more and more nurses for the way our health system is developing.
I have a quick question.
Yeah, please.
For like putting nurses into each of the categories, state, regions.
Yes.
How do you factor in contingent workforce that's moving around?
Oh, that's a great question. Okay. She's asking, how do you deal with travelers, contingent workforce? Yeah. All of this data is going to be based on a survey that's asking you where you are in a snapshot of time.
Okay.
So it's the best you can do.
Be captured in the state they live in is probably it. Yeah.
Yes, it's state of residence. But if you move around a lot, yeah, I'm just taking a snapshot at one point in time.
Can I ask a quick call?
Yeah, please.
On all of these slides, seeing that it's really good to see the regional piece.
Yes.
Do you have data or an opinion around is the differences or the leveling? The one slide that showed kind of Northeast had it, now it's red. Is that by creation and graduation of matriculation of new RNs, or is it migration?
Yeah, I'm gonna show more about that. It's more of the first. It's more of inflow and education, but there is some migration too. Yeah. Okay. So here I'm just putting together the past growth and the future expected growth, all combined, and you just see. So if you were to take between 2000 and 2030, what is the total growth in per capita RN supply? And here in these regions on the right, it's a doubling. It's really dramatic, and about 40 compared to about 40% in the Northeast. Now, it's important to note, I know that a lot of us are especially thinking about the hospital, and all of this is regardless of where you're working, but the picture is different in the hospital. This is 2019 to 2023. Almost all of the growth in total RN supply is outside of the hospital. It's in those all other settings, ambulatory, even long-term care, wherever. Hospital is pretty flat, okay? And on the right, if you subdivide the hospital RNs by age, you see that younger RNs, there's still an increase, but it's the RNs age 40 and over who are leaving the hospital. There's a net drop. Even among all this growth, there's still a net drop of RNs age 40 and over working in hospitals. So keep that in mind through all of this. And this is just showing that in a different way, the percentage of RNs working in hospital settings. And here it's defined broadly, inpatient, outpatient. It's just gradually dropping over time. So again, an updated picture of that kind of leveling. I'm just showing the same graph of the 2000 and the 2023, and then 2030 on top of it. So this is where we expect the distribution to look like in about 7 years, that the East South Central will have the most RNs per capita, which is about 50% more than you'll have on the West Coast. That's a big difference, 50% more. Here's a sense of, it's a good question. How do wages fit into all of this? I'm just showing supply on the bottom, so the most RNs to the right, the fewest to the left, and how does that relate to average earnings? And you see this downward pattern, and economists would say, great, economics is working, but in any case, I don't have any, I'm not saying this is good or bad, but the highest wages are in the places with the fewest RNs out on the West Coast. The lowest wages are in the places with the most. There's a lot of things going on behind this, but at least part of it is probably a simple supply-demand kind of story. You just have shortages out there. It's also expensive to
That's
live.
the contingent workforce. They're all going out there because they don't have enough nurses.
Yes, I will show you that. Yeah, you're
It's just
totally
going to keep
right.
doing that because it's not getting any better.
I wanted to look a little bit at migration. Okay, yeah.
I was curious because I'm on the West Coast between Hawaii and LA, and it seems like
Oh, you go to both. Yeah.
my family lives in Hawaii, so I
Nice.
go there once a month, and then in California.
Okay.
It's cost of living. I mean, how
I
does
know.
cost of living factor into that supply?
That's part of it. I mean, everything is more expensive. I have to. It costs more to live there. I have to pay you more to retain you, for sure. Everything is more. Yeah, that is part of it. And I don't know how much the minimum staffing ratios in California make it a little harder to hire RNs. I'm not sure. It might be a small effect.
I think it makes it easier to hire RNs
Okay.
with the ratios because they want the staffing. That's what we hear from travelers, particularly.
Yeah. Okay. So I have two slides on different views of migration. This one is starting with where you got your basic nursing education, then where do you go? So I'm showing this contrast of these blue and these red bars. The blue bars are telling me you got your education in this region, but now you work somewhere else. The red bars are the opposite. You work in this region, but you came from somewhere else. So the reds are the imports, the blues are the exports. And if you go to the states on the left, those I'm calling the exporters. So New Jersey, New York, Pennsylvania, you educate a lot of RNs who then leave and go somewhere else. And you don't pull in very many. And then all the way on the right, you have the West Coast, which is pulling in a ton from other places. They're not exporting very many RNs at all.
It's like a buy or build scenario, right?
Yeah,
If
it
you're
is
in
that.
California, you can either put the investment into educating or you can pay more
Yeah.
and draw people.
That's right. And I haven't looked at, are there fewer schools in California? There might be, I don't know that for a fact. But for whatever combination of regions, you have a real difference in the push and pull. I kind of looked at the specific flows, and here's some of the biggest movements of where you get your education to where you then work. I'm just drawing some arrows to show you. There's movement from mountain to Pacific, from the Middle Atlantic to work in the South Atlantic. Everybody's going to the Midwest for some reason. So those are just some of the flows. Yeah.
Just curious, did you look at age ranges for the importers and exporters?
No, that's a good point.
I'm just thinking about our conversation last.
Yeah. That would be good to look at.
Because I have assumptions that there's a lot of young new grads going to, or newer, maybe not just new grads, but younger, migrating to larger metropolitan areas,
Yeah.
as we talked about. So
I've heard some.
when I look at this, it makes sense.
Yeah. I heard some of that this morning.
And practically what we see too is then when they're ready to have children, they want to move back to where they came from, to be by family where they can afford a home.
Yeah. And right, things like housing and cost of living are definitely a factor in these decisions.
But then the birth rates are lower, so that's not right. There's some variables.
It's all related. Yeah. But I think that's probably true. Probably the first wave of migration is probably just when you finish school, and then there's more, afterwards when you're starting a family and so on.
And I'm sure you hear, because I hear the stories in journal or wherever, like general population, take nursing out of it. The Midwest is becoming a popular destination because of affordability of housing for young people. And I think the Midwest is trying to capture that interest because they haven't normally been able to compete in the rest of the country for young talent.
I think the same for South Atlantic.
Okay, and then a different view of migration here. Rather than comparing where you got your education to where you work now, I'm just looking between 2021 and 2022, just in 1 year. So you can see we're just talking a few percent, but there are still important flows year to year. And the similar kind of thing, the red means you pulled people in, the blue means people left. So the West Coast is doing the best in terms of pulling people in, as we were saying. That's probably a lot of the travelers. And that's the highest earnings. And on the left, those are the areas that are net losing people to migration from 21 to 22. So there is some kind of correlation with people chasing higher earnings, but there's a